Hello, everyone, and welcome once again to Family Connections Adapt Coalition's YouTube Watch Party series. At this event, we have the honor of having Tiana Mitchell, a student who's joining us here at Adapt for a few weeks, along with Yisel Alaoui, who is from the Partnership for Maternal and Child Health. We will let them introduce themselves before we get into the official Watch Party series. So first and foremost, Tiana, welcome.
Thank you, Joel. Thank you for the introduction. Hi, everyone. My name is Tiana Mitchell. I am currently a student at William Paterson University. It is currently my senior year. I am interning with Joel Torres at the ADAPT organization, and today I will be presenting fetal alcohol syndrome spectrum disorder on young expectant mothers.
Thank you. And Yisel, welcome.
Thank you to both of you, Joel and Tiana. What an honor to be here again once more with you guys in the coalition providing this important information. I'm Yisel Alaoui. I'm the Community Education Coordinator for the Perinatal Addiction Prevention Project at the Partnership for Maternal and Child Health. Thank you for having me.
And thank you once again for being here. We appreciate it. As we do with all of our watch parties, we like to just give our viewers a quick little tidbit about who we are and what we do here at Adapt. First and foremost, if you have any questions, if you want to learn more about who we are and what we do, if you want to get involved and become a member, visit us at the website www.essexadapt.org. We're truly excited to continue to grow our membership here as part of the substance use prevention groups in Essex County. For those who don't know about ADAPT, we're a coalition. That basically means we're a group of volunteers, except for our staff, that work to prevent and reduce underage drinking and substance use disorder here in Essex County. We empower our youth leaders, we empower our community members, and we collaborate with amazing community partners like Yisel to improve education and awareness, while also advocating for local and countywide programmatic and policy changes. Our biggest goals are to build relationships and build collaborations with our local partners, but then also preventing and reducing underage drinking and substance use disorder here in Essex County. Specifically, we focus on prescription medication misuse and abuse, underage drinking, which is a topic that Tiana will be touching base on today, underage drinking, alcohol abuse, and also youth tobacco use and vaping use. We have a structure where we work in different committees, and these committees work on the ideas and developing the action items needed to move forward in a productive manner. We're managed by Family Connections and funded through various state grants and federal grants, from the Office of National Drug Control Policy at the federal level to the New Jersey Division of Mental Health and Addiction Services at the state level. Family Connections has been around since 1879, and that's not a typo. 1879, yes, over 100 plus years of providing amazing services to families in northern New Jersey and making sure that we can build a stronger, safer, and healthier New Jersey. As I stated already, we focus on several problem areas, so I won't get into that too much, but we do have 4 committees that we have right now as part of the coalition. One is our underage drinking committee, which focuses on efforts related to underage drinking, like this presentation that you're getting today. We have a prescription drugs committee that focuses on our prevention efforts related to prescription drugs, an interfaith committee that focuses on expanding the prevention infrastructure around our interfaith communities in the county. And finally, our newest committee, our LGBTQ plus committee, focusing on building that prevention infrastructure to support the LGBTQ plus community here in Essex County. And finally, we follow what's called the strategic prevention framework model. That basically means that we start from assessing a problem, collecting data, and finding out what's really going on, to building capacity, building relationships, planning, implementing, evaluating our efforts, and throughout the entire process, making sure that we're culturally competent and that we look at sustainability and making sure that we have long-term effects in the work that we do. But that's enough about us and the work that we do at ADAPT. Now we'd like to bring you up to speed with today's presentation. And we are excited to have Tiana here with us. Tiana is, as she stated, a student at William Paterson University, and she will be presenting on the topic along with our guest, Yisel Alaoui, who is a perinatal addictions community education coordinator for the Partnership for Maternal and Child Health of Northern New Jersey. So with that said, take it away, Tiana.
Thank you, Joel. Okay, so some facts and research on fetal alcohol syndrome and fetal alcohol spectrum disorder, which is also abbreviated as FAS and FASD. What is fetal alcohol syndrome? Fetal alcohol syndrome is rendered as the most involved end of the fetal alcohol spectrum disorder. People with fetal alcohol syndrome have a CNS problem, which is short for central nervous system, minor facial features, and growth problems such as prematurity. People with fetal alcohol syndrome can have problems with learning, memory, short attention span, and other things such as communication issues. It is known to be the most severe and widely known diagnosis. Children with fetal alcohol syndrome usually have behavioral issues. They have trouble getting along with other children in school. So what is fetal alcohol spectrum disorder? Fetal alcohol spectrum disorder are a group of conditions that can occur in a person whose mother drank alcohol during pregnancy. These effects can include physical problems and problems with behavior and learning. A person with fetal alcohol spectrum disorder often has a mixture of these problems. So the cause and prevention of fetal alcohol syndrome and fetal alcohol spectrum disorder. So the cause for fetal alcohol spectrum disorder is when a developing baby is exposed to alcohol before birth. The alcohol in the mother's blood passes to the baby through the umbilical cord. There is no known safe amount of alcohol during pregnancy or even when trying to get pregnant. There is no safe time to drink during pregnancy. Alcohol can cause problems for a woman's pregnancy, including before a woman knows that she is pregnant. All types of alcohol are equally harmful, including all wines and beer. No exceptions at all while a woman is pregnant with child. And then we have the prevention. To prevent a child from having a fetal alcohol spectrum disorder, a woman should not drink alcohol while she is pregnant or might be pregnant. Also, it is important to keep in mind that a woman could get pregnant and not know for up to 4 to 6 weeks. Okay, so now we're going to move along to some signs and symptoms of fetal alcohol syndrome and fetal alcohol spectrum disorder. To the left, I do have a photo of what it looks like to be a baby who has some kind of physical features going on with them in regards to fetal alcohol syndrome. So a person with fetal alcohol syndrome and fetal alcohol spectrum disorder might have low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, problems with heart, kidney, or bones, shorter than average height, and small head size, along with abnormal facial features such as a smooth ridge between the nose and upper lip. This ridge is called the philtrum. So for some treatments for alcohol syndrome and fetal alcohol spectrum disorder, fetal alcohol spectrum disorder lasts a lifetime. There is no cure for fetal alcohol spectrum disorder, but research shows that early intervention treatment services can improve a child's development. There are also many types of treatment options that includes medication to help with some symptoms, behavior and education therapy, parent training, and other alternative approaches. No one treatment is right for a child. The child can have good treatment plans along the way, like close monitoring and follow-ups. Okay, so here are some interventions for fetal alcohol and fetal alcohol spectrum disorder. So there are two that I found on the CDC website. There are two strategies that the CDC promotes to reduce the number of alcohol-exposed pregnancies, which is alcohol screening and brief intervention, which is short for SBI, and choices. Okay, so intervention. It is an effective but underused preventative health service represented by the U.S. Preventative Services Task Force and covered by the Affordable Care Act. Similar to hypertension or cholesterol screening, alcohol SBI can occur as patients' wellness visit. It involves a validated set of screening questions to identify a patient's drinking pattern while only taking a few minutes. A short conversation with patients who are drinking too much and referral to specialized treatment as appropriate. Okay, so then here's the intervention for choices. So choices is an evidence-based counseling intervention based on activities and research has shown to be valid and effective for non-pregnant women that helps them reduce or stop their drinking, use contraception effectively, or both. Choices uses motivational interviewing to increase a woman's motivation and commitment to change. Okay, so here's some research that I've got off of Partnership for Maternal and Child Health. And the main one that stuck out to me the most was Smart Choices for a Healthy Life. This stuck out to me the most because it basically talks about children who suffer from fetal alcohol syndrome and fetal alcohol spectrum disorder. So this community/program is a part of Maternal and Child Health of Northern New Jersey for students grade K through 12, which teaches children about the dangers of drinking alcohol and fulfills New Jersey's curriculum requirement for alcohol and pregnancy education. Okay. So now we're moving on to the National Organization on Fetal Alcohol Syndrome, also abbreviated as FASS, from the Partnership of Maternal and Child Health of Northern New Jersey. This organization focuses on important topics such as the overall effects that alcohol can have on the body, why some people who drink alcohol become addicted while others do not, what can happen to human development when a pregnant woman drinks alcohol, an age-appropriate overview of fetal alcohol spectrum disorder, and the importance of treating all people with respect regardless of individual capabilities or disabilities. So now we're going to be moving on to educating students with fetal alcohol spectrum disorder. Learning for children with fetal alcohol spectrum disorder continues throughout his or her lifespan. It may be difficult with some students with fetal alcohol spectrum disorder to recognize their limitations or functioning difficulties, but these will become more apparent as the student ages and social demands increase. A team approach will help classroom teachers meet the complex needs for students with fetal alcohol spectrum disorder. Successful collaboration involves teachers, parents, students, and administrators, as well as community service providers from areas of mental health, social services, and developmental disabilities. The most important thing to remember when teaching a student with fetal alcohol spectrum disorder is that the student has the capability to learn. So the New Jersey Task Force on Fetal Alcohol Spectrum Disorder. The mission of the New Jersey Task Force on Fetal Alcohol Spectrum Disorder and other perinatal addictions is to promote awareness of the impact of exposure to alcohol and other developing substances on the growing fetus, identifying children and young adults with fetal alcohol spectrum disorder through screenings, and lastly, promoting coordinated lifelong services and support for those affected by prenatal exposure to alcohol and other substances. So here we're going to talk about age-related advice for families by the New Jersey Task Force. So the important advice for infancy, early childhood, birth to 5 years old. Utilize low lights, follow a routine, and decrease stimulation for better sleep. Schedule a mealtime and reduce distractions to encourage better nutrition. Provide structure and routine. Utilize calm activities, family involvement, and community support. And utilize positive reinforcement and provide immediate and consistent consequences. Okay, so now we're moving on to middle childhood. So this is about elementary to middle school, 5 to 10. Assisting your child in developing friendships with younger children one at a time. Encouraging your child to participate in clubs with structured activities. Keep activities brief and offer one-on-one assistance with homework. Using calming techniques for tantrums. And discussing alcohol and other substances. Okay, and then we're moving on to adolescents. This is 11 to 21 years old, so like middle school, high school. Encourage the adolescent to participate in structured activities. Closely monitor activities and whereabouts to promote and maintain safety. Discuss sexual education. Create an open dialogue about appropriate and inappropriate touch. And provide consistent reinforcement for positive and negative behavior. Okay, and then we have adulthood, which is 21 plus years old. Enroll in group activities such as adult classes or clubs to maintain social relations. Provide structure and routine. Continue monitoring of activities and whereabouts. Okay. Educate about finances slowly and consistently. Examples are setting up simple accounts. Seek out jobs that are structured and limited, stimulation to reduce stress, and continue discussion on sexual education. Okay, and this is a little interesting fact that I looked up myself. So, did you know that fetal alcohol spectrum disorder has a national holiday that takes place on September 9th every year at exactly 9:09 a.m.? Events are held around the world to raise awareness about the dangers of drinking while pregnant. Also, the first Fetal Alcohol Spectrum Disorder Day was celebrated on September 9th of 1999. This day was chosen so that on the ninth day of the ninth month of the year, the world will remember the day during the 9 months of pregnancy a woman should abstain from alcohol.
Thank you so much, Tiana, for all of that valuable information. And it's very beneficial to learn understanding fetal alcohol syndrome, understanding fetal alcohol syndrome disorder, and getting a knowledge and insight into the benefits of understanding and finding programs and resources available. So thank you so much, Tiana, for that valuable presentation that you just provided for our coalition members.
Yes.
Thank you.
Now I'll pass it back on to you for a very productive question and answer session that we will have with Yisel. For anyone who is watching this video on YouTube, you can always ask a question in the chat and we'll try to get back to you with a reply from Yisel with more details and information. But with that, without further ado, Tiana, I'll pass it on to you.
Okay, thank you. All right, Yisel, so I just have a few questions. My first question for you is, how does fetal alcohol syndrome affect daily living?
Thank you, Tiana. And yes, I just wanted to say, as Joel said, thank you for that wonderful presentation because you sure did cover a lot of information, and that's actually one of the answers in that question. It all depends, right? Because we know alcohol impacts any part of the brain, and it can affect anything, right? So there's no a cookie cutter for any particular person. Some people might have problems with memory. Some people might have problems with other executive functioning. Remembering. Like I said, memory, space. There's a lot of sensory problems. So again, it really depends on the individual. It really depends on their adaptive problems throughout the lifespan. And again, this can be from person to person very differently, and it can range from mild to severe. So it's across the board. So when it comes to how those, and it's, fetal alcohol, the syndrome, we know it's actually, a syndrome, but the spectrum disorder is a whole different ball game, right? It's the one that is the most difficult to actually, for individuals to actually get services. Because if you have the face, you have a case, right? You know it's fetal alcohol syndrome. But when the child doesn't have the face impacted by alcohol, it's very hard um, to know, right? To know unless mom come out and say, I drank during pregnancy in order to get, the diagnosis that they need, right? Whether that is fetal alcohol effects, fetal alcohol, or if it's partial. Again, we need to have mom to come out and say, I drank that in pregnancy. So in that way, the child can get services, for whatever problem they may encounter. So I just wanted to kind of clarify that because I know when you talked about the symptoms, you included both of them. And I just wanted to make sure it was clear that when we talk about the syndrome and the spectrum disorder, it's different.
Okay, thank you for that answer.
Sure.
Okay, so my second question is, at what age can fetal alcohol syndrome be diagnosed?
Okay, so again, when we talk about the syndrome, Usually, if they have the face, we don't need to I even ask mom whether or not she drank, during her pregnancy. It's almost a given, right? However, when the child doesn't have the face, obviously, ideally, we will start seeing when the brain start acting, right? When the brain start working. So ideally, it will be from birth to before pre-adolescence. We're talking about at least 8 years old. However, here in the state of New Jersey, we can diagnose an individual all the way to the age of 21. And ideally, we will want to have someone, from, genetics that will be able to diagnose this child, a pediatrician, right, that is able to diagnose. However, even adults, many adults nowadays can get diagnosed by using their insurance and going independently to see a person that can diagnose them.
Wow. Thank you. I didn't even know that for myself. So.
Well, that's why you have me, right? So, the reality is, and that's the problem, Tiana. Again, uh, a lot of these children, we don't start seeing problems until they actually are in school. We start seeing the problems with the math, the arithmetic, the comprehension, and usually that's around what, third grade and fourth grade. That's when you start, they can't remember the timetables. It's hard for them to recall, and then we start seeing that, or even early, you mentioned that, different stages in a child. We start seeing like maybe the child haven't reached the developmental milestone, they haven't jumped hop at the time that it's supposed to. So it's so important to have those to screen, right, to us during that pregnancy, because then it can tell us whether or not there was a pregnancy that was exposed to substances, whether it be alcohol or drugs, right? So we will know the outcome, right? Again, even with the substances, you will see problems in developmental delays. So we will see the impairment in early child development.
Thank you. My third question is, does fetal alcohol syndrome shorten life expectancy?
Does fetal alcohol shorten the life expectancy? And again, that all depends. And the way I'm understanding that question is because, again, if I have, for example, I cannot remember a simple rule of passing crossing the street by looking both ways. If I cannot retain that simple rule that I need to look both ways before I pass the street, and I'm by myself, I'm 8, 9 years old, and I can't remember this, what's going to happen? I will be at high risk of getting hit by a car and dying. So again, it depends on that and the brain incapacity that that person might have, that individual, that could put them at risk for trouble, right? They don't understand the word danger. They don't understand that, don't talk to strangers, and they end up living with strangers. So again, all that puts them at risk. And again, you got another thing to remember, Tiana, is that many of these children with fetal alcohol spectrum disorders and even the syndrome, not only is the brain is damaged, but there's a lot of other health compromise issues that this child can have. So again, as a result of that, these children have chronic ear infections, chronic, organ problems, heart defects. There's so many other chronic things going on that, yes, it can impact a child from maybe not living his full expectancy. However, now with a lot of help and early intervention, we know children can live longer, right? But because they have that external brain helping them, right? The teachers, the social workers, the support systems that is helping this child, continue to live longer. But without no help, without no services, its short expectancy would be very short. Again, they are high risk, high risk. If they don't understand what's going on with them, they are very high risk also of suicide. A lot of these kids, they suffer from a lot of problems, mental health disorders, substance use disorders. They have impulsivity and aggression, and they can also probably have histories of trauma and abuse, problems with jobs, finding job, homes, social support if they don't know how to relate to others. So again, this can put them at high risk, for ending up their lives in an early. So again, when we look at this, can it be shortened? Absolutely. But can they live longer? Absolutely. So it goes both ways. Depends on how you're looking at this question. I hope I answered your question.
Question 4, Can getting drunk once during pregnancy hurt the baby?
Good question, Tiana. And again, the word drunk is very broad. We do know that any woman having 3 or more drinks at a sitting at one time is going to be the most obviously harmful for the child, right? So again, we have to take a look at mom's genetics, and we have to also take a look at baby's genetics, how they're able to break down the alcohol, and many other environmental factors, right? We have to look at whether or not mom is taking, the prenatal care vitamins. We need to know. The good news is that anytime mom stops using alcohol during any time in pregnancy, that baby thrives. That's the good news, because remember, it continues to be in constant developing. And again, when looking at whether or not the baby gets hurt, you got to look at what's happening in which trimester, right? What's being developed. So it depends how much she's drinking, dosage, and again, we do know 3 more at one time is the worst. What we call that a binge drinking. So so necessarily what's drunk is a broad term. I could get drunk with 1 drink, but that's just me, right? For another person, it can they can have high tolerance and they might need more drinks. So it depends on each individual woman, her genetics, and how she metabolizes the alcohol as well as the babies.
Thank you for that. Okay, and question 5. Can the brain of the child recover from fetal alcohol syndrome?
That's a good question, because the reality is, because this happened organically, Tiana, um, there's actually, organically speaking, the damage is done, right? However, the good news is that there is some promising news, Tiana, stating from a doctor, Dr. Thomas, in 2011. He actually suggested that taking choline, um, you know, in animal studies, get promises, if this is an animal study, promising in stating that we got to remember that the brain is plastic, and neuroplasticity is not a theory. So across many levels, and in a cellular levels and neurons, you can change, you can mitigate the pathways of the brain. And remember that our brain doesn't fully develop until later on, right? So with medication, with supplements, with vitamins, with having good nutrition, all of that is going to be good for that individual, right? For that brain, for that to continue to have that healthy brain. So yes, what happened organically, it happened there, but we can still try, through good nutrition, through good support system, change the way we think, right? Our neurons and our pathways, and help an individual that has alcohol, the syndrome of the spectrum disorder. So the brain is really miraculous, and and that's the good thing, right? Because we can try so many things with individuals that are affected by alcohol.
Okay, thank you. Thank you for those answers.
My pleasure.
Thank you, and thank you, Tiana, for facilitating that question and answer session with Yisel. Very important questions that were asked. Yisel, before we wrap up here with Tiana, do you have anything that you would like to promote as far as any of the programs or initiatives that you and the partnership are working on right now for our viewers?
And thank you, Joel. I just wanted to say that I'm so grateful for this opportunity, because one of the things that I want to remind everyone is that, we are in April, and April is Alcohol Awareness Month. And this is such good, important information to discuss at home with our families, right? We can talk about the laundry, but we can talk also about, if we are home, especially now during COVID, we're drinking more, right? And again, if you're not planning a pregnancy, you're putting the fetus at risk. And so many women, like Tiana mentioned, they don't even know they're pregnant before they already have hurt their developing fetus. And I know no woman wants to hurt their baby. It just, again, they didn't plan it, they didn't use, contraception, and or maybe they didn't have this information. So my goal is for everyone to recognize that, when it comes to alcohol, and I'm sure, Joel, you're going to do more, talks about alcohol. there's really no nutrients on it, right? And you wanted to get the antioxidants from wine, you need to have at least 25 glasses of wine to get an antioxidant. And who's going to drink that, especially in pregnancy, right? So there's so much misinformation. So I thought this was so great that Tiana was able to put up this information together and did beautifully, kind of capture how alcohol impacts all throughout the lifespan. It's not something that a problem that is going to come and go away. No, we're dealing with a lifelong disability, that is 100% preventable, that it doesn't need to happen as long as we plan those pregnancies. And again, we do sometimes everything right, and we still might lose our pregnancy. We will start a stillbirth or a miscarriage. Imagine knowing this information. So knowledge is power. And as a perinatal addiction specialist, I just want to say to Tiana, thank you so much for your interest in this topic, and Joel, for you to be able to bring Tiana and bring her to do this wonderful presentation, because without your approval, she cannot do it. So I thank you for that. And I think that's the goal, is to continue having these talks in our community. And again, I'm available for any other presentations in regards to alcohol or fetal alcohol syndrome, or you guys want to have a part 2, we can continue to talk about, because there's so much to learn on this topic, and yet there's so little information out there. So thank you to both of you for this opportunity.
Thank you.
Thank you, Yisel. And for those, if you want to follow the Partnership for Maternal and Child Health of Northern New Jersey, they are on YouTube as well with amazing information for our families, but also on Facebook and other social media platforms as well. And with that, I'd say you can also stay connected with Adapt and with the work that we're doing through Facebook, Twitter, Instagram, and of course here on our YouTube page. We will continue to host these watch party series with you to help educate you on some of our local partners and some of the most pressing and important issues as it pertains to substance use and prevention here in Essex County. So thank you very much for joining us. And once again, Yisel and Tiana, thank you. Have a good one.
Thank you, guys.